Another very common cause of back pain is the joint between the sacral part of the spine and the pelvis or the ilium, and that is called the sacroiliac joint. On this model, this is the sacrum, and the ilium or pelvis bone sits right here. And this typically will cause pain in the lower part of the back. But the facet joints are extremely close to the sacroiliac joint. Here's the SI joint and here's the facet joint. So these areas can be very overlapped in terms of the pain generator. Where's the pain coming from? And so if we suspect SI pain based upon the history and physical exam, sometimes I will recommend SI joint injections, which is similar to the facet injection, by placing a needle into that joint, injecting steroids and lidocaine. Sometimes we can burn the little nerves, the rhizotomy of the SI joint. And if all that gives help but doesn't last, there's a minimally invasive surgery called an SI joint fusion, which I can do through a tiny hole and placement of a minimally invasive device through that joint and fixate that joint. And there have been excellent results with that when it is indicated. As in any other neurological procedure that we perform, there is risks associated with the SI joint treatment, including the SI joint injection, the SI joint rhizotomy, and SI joint fusion procedures. They all have risk of damage to the joint, of infection, of bleeding in the area, of damage to adjacent nerves and adjacent structures. Another risk is that it doesn't help, or it does help and the pain comes back. And these are all common, risks of any procedure. There's naturally risk of allergic reaction, anesthetic risks occur with any procedure, and unfortunately with any of these anesthetic or allergic reactions is the very rare risk of even death from these types of procedures. Again, this is extremely rare, uncommon, very unlikely, but one that we have to make sure that you as a patient are cognizant of.